Hey guys, Dr. Lee here from Head to Toe Spine Sports. Just want to go over some knee pain, like of non-traumatic origin. So this episode is not necessarily going to be about like an ACL or an MCL injury or a meniscus. It's more so going to be about like a tendonitis of like the knee or like that front of the knee. Whenever you get knee pain in around that patellar tendon or just below your kneecap. These are what we're seeing a lot of lately. A lot of people going out on runs. They've been used to sitting at home during those stay-at-home orders. Some people just getting back into training more and more, and they're starting to notice some tightness in areas that they usually don't have it. So some quick and easy anatomy to go over real quick is we've got this big long bone in our thigh. This is our femur. And then our femur attaches to our tibia, which most people know the tibia, and then there's the fibula on the outside here. Not as important for the knee pain, but still if it gets locked in here, because this is a joint between these two bones, if there's not mobility between those two, that oftentimes is going to cause a lot of compression in this knee joint itself. Things that we can't see here that's not pictured is our patella, or our kneecap, that sits right on the top here. And that guy is what we're going to talk about a little bit more, because when the kneecap gets compressed, generally speaking from a quad muscle, that front of our thigh getting really tight, it will pull the kneecap towards the femur, and we can get something that we call patellofemoral disorder or dysfunction. And that's going to arise with this patella essentially bumping into the femur, patella, femoral, femur. So these guys are dysfunctional. They're not allowing that kneecap to track up and down properly, and that's going to cause issues because we're going to get swelling indicated and tender around that whole knee joint, especially in the front underneath the kneecap. And that's just a really easy one that we can address, because all we got to do most of the time is take a lacrosse ball to that really tight quad muscle. Generally speaking, people with this issue will also be really quad dominant through their squatting or their running movements. So if we were to go give you a squat to kind of diagnose your movement, knee will go past the midfoot, and the butt won't go back as much as it should, which we're not going to be loading our glutes and our hammies at that point. We're going to be loading our quad, which over time, that sustained loading can cause tendonitis, which is going to segue us into the next thing. Patellar tendonitis. So we're talking about the front of the knee here, just below the kneecap. Very typical spot for our patellar tendonitis right in here. That tends to be from an overactive muscle or an immobile joint. Most of the time, it's a combination of the two. When we're talking about that femur and that tibia complex, if we get a counter rotation in one direction, typically speaking, our femur is going to go internal and our tibia will go external, and we'll have a lot of pinching going on in the front and the outer part of the knee. So we can get patellar tendonitis from that, or we can get IT band tendonitis from that. So the IT band attaches on the outside of the knee. So a lot of runners will get runner's knee. A lot of people that have outer knee pain on the lateral aspect here, it's going to be from the IT band, which actually starts at the top of the hip, goes down the side, and attaches on the outer tibia here. So with that counter rotation, we're going to get overstimulation of that tendon. Things are going to start to fray. We're going to get some tendonitis, some inflammation of the tendon itself. And similar ways that we address all tendonitis in the office is we're going to do a lot of soft tissue work. We're going to show you a bunch of lacrosse ball techniques so that you can address the tightness on your own at home. We're going to use some chiropractic manipulation to adjust those joints, make sure they're properly moving on one another and not restricting each other's motion. And then the last thing we're going to do, the most important thing as always, is going to be your corrective exercises. So it's probably going to be a combination of straight leg raises, maybe some squatting pattern techniques, some other things to strengthen your glutes and your hamstrings. All in all, what we need to do is we need to balance out the muscle tensions in the area. We need to make sure that there's a good environment for healing to occur. And all of that's just going to be done through a combination of those three therapies I was telling you about. So if you guys are wondering more questions, maybe what I was just explaining doesn't match up with what you're feeling, go ahead and give us a call. We'll help you out. We'll get you in.